Hi, my name is Camila Andrade, and the video I'm going to talk about glenohumeral osteoarthritis and patients' profile and outcomes of shoulder arthroplasty. Osteoarthritis, also known as degenerative joint disease, is an article disease that gradually develops over time and typical originally in the cartilage of major joints in the body. And it impacts the underlying bone and cause development of bones, spines, and joint space narrowing, which can be diagnosed with radiograph imaging. Furthermore, it can be accompanied with significant pain, muscles stiffness, and weakness, joint crepitus, tendinous, and miscellaneous. It most commonly affects the weight begin joints of the hip, knee, and spine, but it also prevalent in the shoulder and hand.
Hi, I'm Dr. Brad Parsons. I'm going to discuss a case now of shoulder arthritis in a gentleman who's 70 years of age. As you can see on the images on the slide, his left shoulder is fairly arthritic, and when I got advanced imaging, we could see that he has fairly significant biconcavity of his glenoid and some posterior wear and subluxation. So these often present a challenging situation for the surgeon. Do we do an anatomic replacement with either an asymmetric ream or some other option for the glenoid to try to support it? Or do we consider a reverse shoulder replacement in someone who is perhaps not quite as physiologically active or a bit older? Although this gentleman is 70, he's quite active, and I chose that perhaps the best choice for him will be an anatomic replacement. The other aspect of this case that's challenging for surgeons is the technical aspects of doing the surgery. A biconcave glenoid is hard to visualize, exposure is difficult, instrumenting the glenoid can also be difficult, and so one of the things I like about the Arthrex system is the Nautilus reamers. They allow me to use the offset guides to be able to gain back to neutral version on the glenoid. Everything's based off that center guide pin, which the offset version guides allow me to place carefully and precisely. And then I can use the crescent reamers to get easily past the humeral cut surface and fukuda retractors to allow me to ream in an asymmetric way, again to an appropriate depth that I've carefully planned, especially if I've been using the VIP software. So here's our follow-up of that patient, and you can see here on his final image, he has a nicely placed short stem apex implant with a properly seated, well-fixed glenoid component utilizing the Nautilus instrumentation, which gave us good success in this patient.
The application in physical therapy. The treatment of the OA is determined on as an individual basis. It generally consists of a combination of both surgery and non-surgery interventions. Strictly exercise programs are generally the initial treatment of osteoarthritis. Also, exercise focus on the joint stimulation in order to prevent future joint degeneration.
Hey everybody, it's Dr. Joe, and today I'm going to show you some exercises and stretches for shoulder arthritis. Let's get started. Disclaimer alert, disclaimer alert. So the first set of exercises are going to be your pendulum exercises. These are the ones where you just let your arm hang straight down. Remember, your arm is not actively moving, you're moving your body to make your arm go. So if you are doing this, that's not exactly the exercise. Really just let your arm hang down and you're going to move the whole body to make the arm swing. So making circles, just do 10 one way and then reverse it and do 10 the other way. They're not going to be big circles because you're not actively moving the arm. You're just kind of letting it hang there and go around. Then kind of stagger your feet a little bit. Now your arm is going to go front to back. But again, just let it hang there and then just kind of rock back and forth. And this is just loosening up that shoulder joint. If you have that inflammation and arthritis in there, this will kind of help get some of that out of there before you really start working it. Again, 10, about 10, going that way. And then you're going to do a side to side. So spread your feet out past shoulder width, let it hang down, and then just side to side rocking with your arm going back and forth. And again, about 10 of those as well. Once you get it nice and loosened up, then you're going to do some strengthening exercises. You can do this with a resistive band. I'm going to show you how to do it with a weight. You can use a soup can, a vegetable can, anything like that, a 1 to 2 pound weight. You probably don't want to start off with anything much heavier than that until you've tried it and see how it feels. So the first one with the weight is just going to be a shoulder flexion. You want your thumb to be up on top in the up position. If you had a weight, I usually have people actually hold their thumb on top of the weight because it's easier to hold. But just make sure if you're holding a can and you can't quite grip it like that, make sure your hand is in that upward position. And then just bring it straight up to about 90 degrees. It doesn't have to be exact. And then slowly come back down. So just kind of working those shoulder flexion muscles, and then make sure it's nice and controlled coming back down. So just start off with about 10 of those, and then if that becomes easy, you can kind of work your way up to 20, 25, and then if that's still easy, you can get a heavier weight or a stronger resistive band. Then you're going to do shoulder extension going back behind you. So you're still keeping that thumb in the up forward position and arms still straight and locked out, but you're not going to go back to 90 degrees. That'd be pretty hard without bending over, but maybe about 45 degrees, just as far as you can go comfortably. This is sometimes a little harder for people. So just back to about there, might not even be 45 degrees, and then slowly come back. So whatever's comfortable for you, but try and keep that arm straight if you can. And again, starting off with 10 of those and then working your way up from there. And then the next one with the weight is going to be what we call scaption. And scaption is not quite all the way in the front and not quite all the way out to the side, but it's about a 45-degree angle in between. And so, you're not here, you're not here, you're right at that angle there, but still keeping that arm nice and straight, keeping that thumb in the upward position, and going about to that 90 degrees high. And so that's usually the most comfortable position for people because it's a nice open area in that joint. And again, starting with just 10 and kind of working your way up from there. So now we're going to get down on the ground a little bit. So now you're just going to do some shoulder shrugs, bringing your shoulders straight up, not hunching your shoulder down, but bringing those shoulders up, just like you're like, I don't know, and just getting them moving, stretching those shoulder and neck muscles out. So again, just start off with about 10 of them, and then you can work your way up from there. After that, you're going to go into shoulder circles. So now you're actually getting some movement all the way around. So nice big movements with the shoulders, really squeeze it around when you go to the back. Do 10 one way and then reverse it the other way. So you can kind of use your whole arms for this, really, to get those circles and get that movement, because that's really nice in there, and that helps kind of loosen everything up. And then after you do those, then you go into a row with a resistive band, if you have one. Just wrap it around your feet. Keep your elbows close to your side with your thumbs up again. And when you squeeze back, you really want to imagine that someone has their hand on your spine and you're trying to take those shoulder blades and squeeze the hand. But make sure you're not up like this squeezing. You're really keeping your shoulders down while you're squeezing back. And squeeze like you're trying to squeeze that hand in the middle, and nice and controlled as you do it. Keeping those elbows close so it's not out this way, but nice and close to your side. And make sure you're controlling that band while you're doing it. So again, just start off with about 10 of these, and you can work your way up to 20, 25. If that becomes easy, then you can get a stronger resistive band. So now I'm going to show you a stretch with the Swiss ball. All right. If you don't have a Swiss ball, that's okay. You can use a countertop or a flat surface. I like using the Swiss ball because I feel like you can push it a little bit more, and it also gives a little bit wiggle, so you're working on that stability as well. Also with these, keep the thumb up. I like that because it puts that shoulder in an open position and your shoulder's not getting impinged while you're doing it. It's usually just a little more comfortable. So hands up top, thumbs up on top, and then just roll out. And again, if you've got arthritis in that shoulder, you might not be able to go that far. I actually do have some arthritis in my shoulders, unfortunately, but I've got pretty good motion because I work on it every day. So just kind of a push out, hold it about 3 to 5 seconds, and come back in. If this isn't quite enough, you can do one hand at a time, and usually you can stretch a little bit more with one hand and then coming back in, and I really like that. And you can also go at angles as well, so if you wanted to go out into that scaption stretch, you could, or if you wanted to put it out to the side, you could stretch out that way too, so you can kind of go this way then, and then you're stretching that as well as your pec muscles just a little bit. So there you have it. Those were your stretches and exercises for shoulder arthritis. If you have any questions, leave them in the comment section. If you'd like to check out some other videos, go to AskDrJoe.com. And remember, be safe, have fun, and I hope you feel better soon.
And the pros are the patient with glenohumeral OA will likely be given exercise that focus on rotator cuff and shoulder straining. It conservate the treatment is unsuccessful that reduced system and surgical options are then considered. The surgery is typical only considered once pain has become a surgery and lost the function as being to interfere the activities on the life living. Well, so in the surgery of arthroscopy, there is no many cons. Uh, the only cons that is on the surgery is that the therapy or the rehabilitation isn't it good. So um, shoulder arthroscopy is a safe and effective process. So today's minimally sized invasive techniques shorten recovery times and reduce the risk of complications. And shoulder in surgery can be painful and debilitating. So in the prospect of undergoing surgery to correct the problem just adds to stress for many patients. In summary, the results show that the most significant predictor of TSA is high retain of preoperative pain at rest, but being film and over age 65 are not predictors. Patients can be expected the creative pain, functional ROM, and straight and improve the functional after TSA. Before analysis, the SPTA and CCT, it was determined that both are evidence outcomes measured to assess shoulder pain and function.